Hi, I'm Caroline Terwee. I'm a professor of outcome measurement in healthcare at Amsterdam University Medical Centers in the Netherlands.
And I'm Dave Cella. I'm professor of medical social sciences at Northwestern University in Chicago, USA. And together, Caroline and I are co-editors-in-chief of Advances in Patient-Reported Outcomes, a new Elsevier journal, which is the official journal of the PROMs Health Organization.
So we are excited to start this journal, but people may wonder, why do we start a new journal? So Dave, why do you think there's a need for a new journal?
Well, there's been a rapid growth in the number of articles focused on patient-reported outcomes and their various applications. We started in this field many years ago, really focused on clinical trials and applications of patient-reported outcomes in these clinical trials. But the research has really expanded into looking at the burden of disease and into healthcare communication and healthcare quality, looking at applications of patient-reported outcomes in clinical practice. What about you, Caroline? Why do you think it's important for a new journal?
I think there's room for a new journal because there are so many challenges in the use of patient-reported outcome measures, both in research as well as in clinical practice. So for example, I see clinical trials being published in high-impact journals where they use PROMs that are not fully validated or even not the most optimal PROMs to use. And I see hospitals struggle with the implementation of hundreds of PROMs in clinical practice. So I think there's a role for us as PROM researchers to educate people about the value of PROMs, what good PROMs are, and how to use them effectively.
Yeah, indeed. I completely agree with you. And we'll mention that, in terms of high quality PROMs, of course, we are the PROMs Health Organization and we sponsor this journal. And PROMs is a good example of high quality PROMs that can be used in clinical research and clinical practice. But those aren't the only articles we're interested in seeing in the journal. We would like to see articles that really focus on that key word in our title, advances. Advances really is our key word and the thing that we most value in terms of the submissions we'd like to see. We'd like to see submissions of empirical research, brief reports, literature reviews, your commentaries, your comparative effectiveness research results. Please consider all of these opportunities for submission to this new journal.
Yeah, perhaps some topics of interest to give you an idea about the kind of papers we would like to publish. So we are interested, for example, in research on methods and effects of using PROMs in clinical practice, studies on healthcare improvement initiatives that use PROMs. And we're interested in methodological and educational papers on the development, validation and selection, as well as implementation of PROMs in clinical practice. And again, we're happy to see papers that are using PROMs, but we're also interested in other papers that advances our field.
Well, let me close with a note to all of you that APRO is an open access journal that through 2026 will have no article processing charges. So please send in your submissions soon and you will have waiver of your processing charges for publication. Thank you.
Thank you.